Peter Soltis. I'm the Deputy Leader of the Heart Health team here at SAHMRI, and I co-direct the Vascular Research Centre, which is a group within the Heart Health team that investigates vascular biology and vascular disease. Our main focus is on this disease process called atherosclerosis. Atherosclerosis is the disease which causes plaques to build up in heart arteries. Those plaques are both inflammatory and they're also rich with cholesterol and fat or lipid. Those plaques build in our arteries really from the time we reach adulthood through to old age. And as those plaques build and narrow arteries, they lead to problems like heart attack or stroke. So we're really fundamentally concerned with trying to understand the processes that cause that atherosclerosis to occur, new processes that have previously not been explored or discovered, and then ways in which we can target those processes of disease to actually improve the treatment or the cure of the disease. Our particular group's focusing on a very novel aspect, which is to look at the inflammation that occurs outside of the blood vessel. Up until now, the main focus on atherosclerosis has been on the plaque itself, the buildup of the plaque from the inside of the blood vessel. But we understand that actually around the blood vessel or on the outside, there's a lot that happens. And some of this, believe it or not, takes place at the level of new stem cells that have recently been discovered. During my time in research over the last few years, including time that I spent abroad at the Mayo Clinic in Minnesota, we discovered a new type of stem cell that creates inflammatory cells or macrophages, which are one of the critical players in this process of plaque buildup called atherosclerosis. In discovering this new population of stem cells for macrophages on the outside of the blood vessel, we're now trying to understand what are the things that turn these stem cells on to make them contribute to plaque and other forms of vascular disease. If we can understand what role they play, we can then look at incorporating treatments, new treatments, into our repertoire of treatments that we use in the clinic in patients to try to fight this disease process that causes heart attack and stroke. Ultimately, our focus is to come to two objectives or targets. One is to be better at diagnosing disease and predicting which patients are going to have complicated disease. In other words, which patients with plaques in their arteries are going to have complications from those plaques. There are a lot of people out there that have atherosclerosis or narrowing of their arteries, but they never have a heart attack or stroke. So if we can understand the disease process, and in our case, the inflammatory stem cells that are involved and their role in the disease, we might be able to use that as a way of diagnosing or picking disease up, the disease that's going to behave particularly badly and cause clinical complications. That's the first target. The second target is to develop new treatments and refine or improve the treatments that we already have, to use those established treatments better in the right types of patients. We think that if we can understand disease processes, in our case atherosclerosis, in a different way, perhaps in a more complete or better way, we're going to ultimately be better at developing treatments to really target the problem effectively.